أعزائي المشاهدين مرة أخرى وطبيب على الهواء وضيفنا الدكتور محمد أنور. Dr. Anwar, we've talked about the keratoconus and why it's happened and the complication. Is there any treatment? And it sounds like a rather serious illness. Is there any treatment, an effective treatment to be precise?
Yeah, there's no medical treatment.
Okay.
Once it happens, there's no medicines or drugs we can reverse the disorder.
Right, sir.
Glasses are effective in the early stages, but later on it's very difficult to get a number because of the irregular curve. Contact lens do a much better job because it sits on the cornea itself, therefore the patient can see well. But usually the contact lenses required for this purpose are hard contact lenses or semi-hard, and patients do find difficult to use, especially in our climate with dust, wind, temperature. Allergies are common. So they have hard time with this contact lens, although they can see. But as long as they comfortably can wear a contact lens, that is obviously the best line of treatment.
Right.
The other things are surgical. People are using the rings, what we call as halakat, in early keratoconus. In the late stages, it's not effective. In early stages, it does help to flatten the cornea a little bit and improve the patient's vision. But by definition, this is a progressive disorder. So the treatment with the rings, the surgery with the rings, in my view, is temporary. How many years it lasts, nobody knows, because we don't have a long enough follow-up. The second thing about these rings is that it might prejudice the other kinds of surgeries you might have.
I like that definition. I think it's very important to take in consideration.
Because if you make surgery with rings, you interfere with the corneal anatomy.
Exactly.
And there are two kinds of operations for the keratoconus these days. One is a deep lamellar, where we removed 95–99% of the patient's cornea. We leave a very, very thin layer of a membrane and the cells.
Yes.
And by doing that, we avoid rejection. So the deep lamellar keratoplasty or the deep lamellar graft has virtually no rejection.
Yeah.
And this is a specialist technique which not everybody does. I have an interest in this. I have published quite a bit and been well recognized internationally. The full thickness graft or the complete corneal graft has a rejection rate maybe 20%, and if it's vascular or in a difficult climate and poor socioeconomic conditions, 30 to 40, even 50% corneas can reject.
That's quite high.
Very high. So, and these recent figures from the one of the Indian journals,
Okay.
and their survival rate after 5 years is 46.5%.
Right.
For keratoconus, which is very, very significant.
Yes.
So in keratoconus, almost all the cases are suitable for a deep lamellar graft, which has no rejection.
Right. Right.
And the use of rings might interfere
With this procedure.
with
in
this
the future.
procedure.
Exactly.
You may not be able to do it properly.
Exactly.
So there is a price to pay if you go for this.
That's being very honest, and I do like that.
Yeah.
دكتور أنور الحقيقة بيقول إن لا هناك أدوية أو قطرات أو أي شيء أو نظارة ممكن تصلح هذه القرنية المخروطية، وبعض الحالات ممكن تعالج بالعدسات، ولكن العدسات لها برضو مشاكلها وتقنيتها، وبنقلعها ونلبسها، وفي جو فيه رطوبة وغبار وحرارة شديدة ممكن تكون معوقة. في هناك أنواع أو أنماط جراحية بيعملوا حزمة أو طوق حوالين القرنية، ولكن هنا بيقولنا ده حل مؤقت في نظره، لأن هي مش عارفين نتائجها على المدى الطويل، وقد تعيق بعض التدخلات الجراحية اللي بتعتبر حل أمثل في المستقبل. فالحل الأمثل للدكتور أنور الحقيقة مشكورا قال إن هو في منه نوعين. في نوع بياخدوا 95% ديب لاميرا، يعني من النسيج الداخلي العميق، وبيشيلوه، بيسيبوا جزء من القرنية وبينقلوا قرنية أو زرع قرنية عشان ما يحصلش نسبة رفض. وهو عنده الحقيقة باع وخبرة في هذا المجال محليا وإقليميا ودوليا، وله أبحاث نشرت. والنوع الآخر اللي هو بيشيلوا القرنية كلها وبتحصل فيها بعض نسب الرفض قد تتراوح إلى 20%، وفي بعض الحالات قد تزيد إلى 30-40%. فواضح ان هو ميال للعملية بتاعت الديب لاميلر او النسيج التحتيني، يعني يشيلوا جزء 95% ويخلوا 5%. طب we're talking about now the corneal transplant.
Right.
This is an area which can be rather tricky. Where we're going to get our cornea then if we need a corneal transplant for that particular patient?
This is a very interesting subject. Most of the ulama in Islam
Okay.
have considered this topic, and the use of cornea for donation purposes from a donor is allowed. Still, some of the scholars are against, but vast majority are in favor. But unfortunately, the cultural background of our society is such that the donations are
Not
very
forthcoming.
few.
Yes.
Very few.
Not forthcoming, yes.
So that's the big drawback. Therefore, we are having to import corneas from abroad, from Europe, from States.
And that has its own risk, expensive.
They are expensive, so that's the problem. And they are not easily available.
Yes.
So there is always some waiting list, but we are able to get corneas within a short period of time, when
So we need
necessary.
like a bank, we need an eye bank.
Yes, we have a kind of a bank where we receive corneas, we preserve them, we look at them, are they suitable, and if it's suitable, we call the patient for the surgery.
Right. الدكتور أنور بيقول ان الحمد لله ان معظم هيئة العلماء الافاضل في الدين الاسلامي الحنيف اجازوا التبرع بالقرنية، ولكن نتيجة وجود بعض العادات الاجتماعية والثقافية لأي مجتمع هي بتكون العائق عشان مش متوفر القرنيات بالكمية المناسبة، فبنضطر نجيب القرنيات من الخارج، وطبعا دي بتكون غالية ومحتاجة نقل ومش متوفرة، فبيكون هناك يعني انتظار من بعض المرضى اللي بيحتاجوا هذا النمط من العمليات، وكأنها يعني بنك العيون، بنك للقرنيات للمساعدة في حل جذري لهذه المشكلة اللي عمالة تتفاقم وبتهدد بعض الناس، وقد تهددهم في حتى نعمة البصر إذا تركت ولم تعالج. We'll take another quick commercial break and I'll come back to you, sir. بناخد وقفة عينية أعزائي ونرجع نكمل مع الدكتور محمد أنور، ومعاكم لقائنا النهاردة في طبيب.